Hello, today we're going to discuss the healthcare information technology known as telemedicine, how it is helping providers and their staff bring better healthcare to their patients, and is this the way forward for healthcare in the future? What is telemedicine? According to American Telemedicine Association, telemedicine is the use of medical information exchanged from one site to another via electronic communication to improve a patient's clinical health status. This basically means any electronical means that you can use, whether it be text, email, Skype, however electronically that you can communicate with your provider or vice versa, your provider communicate with you, is telecommunication. What problems does telemedicine solve? The problems that telemedicine can solve are things as simple as eliminating distant barriers. Some patients are located in very rural situations where it can take them an hour to an hour and a half to get into their provider, so they won't go for their basic routine checkups and visits. And by being allowed the access of medical services via telemedicine, they now can interact with their provider more often, and also not worry about losing a whole day's work doing so, having to drive an hour and a half into the provider and back again. It's also helping get rid of the delay of care. In some situations, your provider may be a 15-20 minute car ride away. However, because they are overwhelmed with hundreds and hundreds of patients, you can access them via email or Skype and be able to receive care more quickly, not having to wait 2 or 3 weeks that it would normally take to get in to see them for something as simple as a medication change that they could answer over an email and have delivered to your pharmacy that same day. So there's a lot of ways that telemedicine is benefiting the patient, but it's also benefiting the provider, where the provider can save a slot that they otherwise would have used to answer a medicine question, and they now can leave that spot open for somebody more critical or a new patient. So they might be able to see more patients in a given day than they normally would just via face-to-face appointment system. Governmental factors for telemedicine. If you look at the Medicare website, they are stating that they feel that telemedicine is most cost-effective approach for a physician to see their patients than a typical face-to-face visit. If we look at the state of Indiana, their Senate unanimously passed a bill expanding Medicaid reimbursement for telemedicine services. This follows on the heels of the Indiana Primary Care Association that has stated that over half of the state is not being serviced by primary care physicians, particularly due to the geographical boundaries and the lack of providers available in these rural areas. And this goes back to what we just discussed a little while ago about these patients in these rural areas don't have primary care providers in their town. There just aren't enough of them in the state of Indiana, and so they're just not going to the doctor for just basic medical care. So providing them the telemedicine services, they now have that access that is saving them money, not having to travel all the way in to the closest provider, which again can be up to an hour, hour and a half away, and vice versa. It's saving the provider time and money, not having to travel into the rural areas, but they still have access to take care of these patients. And so the government seems to be embracing the idea of telemedicine as a method of treating patients more quickly with a cost effectiveness for both the patient and the provider. And accessing care on both sides. The provider can do what they want to do, which is take care of patients, and it helps the patient be able to afford to just see a provider for basic needs. When looking at the healthcare information technology leaders' perspective on telemedicine, overall across the board, it looks like leadership is for telemedicine. However, their biggest concern is the privacy of the patient. How are they going to use all of these resources and make sure that the patient's privacy is kept private and only between the need to know healthcare staff and that patient? if you're looking at the medical records part of telemedicine health, there are a lot of digital record programs out there where patients can access their medical records, but some leaders are debating whether that medical record is for full knowledge of the patient or if there should be only parts that the patient can see. And so that is some debate going on between leaders. Some think that the patient should have full access, and some leaders think that part of it should be only medical staff right to see, and maybe shouldn't be open to all the patients. So that's a debate that's going on. The intent of telehealth is convenience of healthcare access and benefits for the patient, but it also alludes to the compromise of patient privacy. Can just any hacker get into that patient's information and access information that could hurt that patient, and or the providers or the healthcare team taking care of them? And so that is something that is a concern among the healthcare information technology leaders. Healthcare leaders are challenged with maintaining and constantly developing programs that will protect private medical information and maintain the liability of the providers in the facility that enables healthcare via telecommunications. Ultimately, it comes down to that provider and the facility they work for and their staff. These leaders want to make sure that these healthcare providers and their staff are protected, so that if someone were to maliciously get into their programs and use a patient's information maliciously, then that patient can come back and blame the healthcare system and say, this is your fault. You didn't put the safeguards in place to keep us safe. And so healthcare leaders are constantly making sure that new maintenance is being done and maintained so that those healthy safeguards can be in place to maintain those medical records, to maintain their liability and keep their providers and their facilities safe. When looking at the technology involved in telemedicine, there are just so many different applications out there for providers and patients to access. So we'll name a couple of them, but this is definitely not the limit to them. Their limit is far greater than what we're going to discuss here in this short time. But they include applications such as websites designed for virtual space visits, virtual caregivers that include implementation of electronic healthcare records, also known as EHRs, and e-health services. A full array of technology utilized for telemedicine include, and are not limited to, the standard telephone connections, face smiles, personal computers, modems, webcams, to utilize such things as Skype or other interaction calls, still images, videos, again video conferencing, robotics, virtual reality interfaces, satellites, transmissions, and smartphones. The benefit of utilizing any of these services versus going in to see a provider directly has been noted to be about a $40 per person savings or per visit savings. But it also gives a more consistency of about 20% to see the same provider when you go in. We've all been in that situation where we need to get in and see our provider, but they're not available, so we have to take somebody else on their healthcare team. You're not quite as comfortable with that new provider. You then spend most of the visit reliving your healthcare life, and it just can be very frustrating. So by accessing these technologies that are involved with telemedicine, you're reducing having to see another provider by about 20%. It's actually giving you a higher chance to actually interface with your actual primary care provider. As we've discussed before, telemedicine has several applications that are available to both the provider and the patient to access telemedicine. What we want to emphasize is that software developers are being encouraged by healthcare information technology leaders that in whatever they develop, whether it be a program or an application for telemedicine, that it upholds patient privacy as top priority and ensures that information will not be unintentionally leaked. It also ensures the readability of patient records and provides information in generality translations, or basically that whatever they provide is easy to use for the patient and that they can be used quickly and easily by both the provider and the patient. Um, they are also ensuring information is communicated from clinicians to the patient and from the patient to the provider, and only within those circles. It is their highest priority that any telemedicine applications or programs that are being developed and used only can be accessed by that circle for the actual care of the patient and not to fall into malicious hands. As we've discussed in previous slides, there are several services for the delivery of telemedicine, such as text messaging, chatting, computer conferencing, video capable applications such as Skype or WebEx meetings, clinical conferencing, and video or robots. But the four most commonly used types of services for telemedicine are high-speed network line links, which help with clinics to centralized providers and special medicine care, point-to-point high-speed connections for delivery of remote services such as specialty services like radiology and mental health services, landline or wireless monitoring centers linked for cardiac, pulmonary, and fetal monitoring, and online e-health patient service sites that provide direct patient care. These are the four most commonly used services, according to Mary Ayres, a author who has done extensive research into the delivery of telemedicine's primary use. So you may want to know how to acquire telemedicine services, and really you just need to touch base with your primary care provider and the facility that they work with, and any specialty care providers that you may have in any facilities that they are working with, to find out what is actually available to you, what services they use on a regular basis and are available for you to sign up for or interact with. There is a lot of providers who use a 24-hour, 7-day-a-week nurse or physician hotline for non-life-threatening situations. And those of you that may have already accessed that, you don't really realize it, but that is one form of telemedicine that you've already come in contact with and is used quite frequently through the healthcare system. Some healthcare facilities, providers, or healthcare companies also offer mobile wellness applications through which a patient can monitor health concerns such as diabetic management, asthma, hypertension, heart failure, and other chronic illnesses. So you just really have to look into what is provided through your healthcare provider and insurance companies, and what you have access to be able to remotely use telemedicine with your healthcare needs. So you may ask if telemedicine is actually being used, and the answer is yes. More than half of the United States providers are using this, not just primary care providers, but specialty clinics, surgeons, nurses, other healthcare professionals, patients, and even faculty and students at various education settings are using telemedicine in the care of patients. When looking at the user's perspectives and impressions, it's split down the middle. You have those providers who are open to the new technologies and the way of taking care of their patients with the new telemedicine perspective, and then you'll have those providers who want to continue to see their patients the same way they've been seeing their patients for years and years and years. Likewise with the patients, you will have those patients who are very open to learning the new technologies and how to access their providers and their health care via the technology, and then you will have those patients who will prefer to continue to see the provider face to face. And so that's a fair assumption of how people like it, but it is expected and hopes that as telemedicine and healthcare technologies improve and become more readily available, that as long as we are adequately training the providers and the patients on the new equipment and the software, they will be more and more open to telemedicine services. It'll be kind of like when the smartphone started, and everybody was kind of gun shy at first, but then as they realized how much easier it made their lives, the more willing they were to use it. And it is believed that as medical healthcare technology improves and becomes more readily used and available, it will also be more widely accepted. When trying to assign value to telemedicine, we're going to look at a study that was done at Bedford Medical Facility in Everett, PA. It was done back in 2009. Bedford Medical Facility is actually about 115 miles, 2.5-hour drive from their main campus, which is in Pittsburgh, at their main medical center. And looking at this study, they looked at about 173 telemedicine encounters that would have cost about $145 round trip for the patient. The costs would have incurred gas, tolls, meals, loss of wages, and child care. And over a 4-year period, about $25,000 were saved for those patients in the 173 telemedicine encounters. So that's a tremendous savings for patients overall. But if you also want to look at how it saved money for the facility, in that year, Bedford was able to bring in about $32,000 for their telemedicine care. And after subtracting the $25,000 startup costs to implement the telemedicine care program, the hospital was able to see a profit of about $7,000. So it was a savings not only for the patient, but also for the medical facility to implement the telemedicine service. Telemedicine impacts the patient. How does it do this? With telemedicine, you are able to provide classes for patients for knowledge of healthcare situations, patient portals, online discussion forums for the patient. It also provides training programs for all levels of healthcare professionals. According to the American Telemedicine Association, the 4 most common benefits of telemedicine are better access to healthcare for those in remote locations, containment or reduction in healthcare costs for managing chronic diseases by reducing staffing needs, cutting travel necessities, and shortening hospital stays. The quality of care equals that received in traditional in-person consultations. In some cases, such as mental health and intensive health, telemedicine has shown even better patient outcome than traditional care. And then addressing consumer demands for healthcare delivery with less travel time and associated stress. When looking at barriers and limitations for telemedicine, some of the most prevalent are the divide between the newer and more seasoned clinicians. Is telemedicine really the way forward for medicine? Is that really how they want to treat their patients? Some people find that telemedicine is a novelty idea and that there needs to be more research on a larger scale and for longer periods of time. Some state and federal legislations limit medical licensures for interstate practices, making it difficult for some providers to actually provide care over state lines where in those rural situations it may be needed. The financial barrier that leadership is worried about putting the money into the equipment and the technology and not being able to reimburse that financial burden. And then patients and clinicians again are concerned about the patient and private security and protecting the health information, also staying compliant with HIPAA. In conclusion to what we've discussed today about telemedicine, yes, there are barriers and limitations to this concept. However, telemedicine has already proven to be able to answer some of the questions and resolve some of the issues we've had in the medical field over the last several years, and it's definitely a application and way forward to possibly research more in depth and see if this is a long-term solution to those problems. Thank you for joining us today, and if you have more questions or would like to gain more information and a different perspective on telemedicine, please feel free to follow the link below. Thank you.